Hello, my name's Becky. I'm one of the midwives that works on the birth centre. I'm going to talk to you a little bit about going home and information you need to know before you go. There's a number of essential checks that will need to be carried out before you're able to be discharged home. These include the newborn infant physical examination, which might be known as the NIPE. This will be carried out by either a paediatrician or one of our NIPE trained midwives within the first 72 hours after birth. Information about this can be found under the Gov website under Heart, Eyes, Hips and Testes Physical Examination. A daily postnatal check will be needed done on you and on baby. Baby will also need a hearing screen from one of our hearing screeners. More information can be found under the Gov website under hearing loss. You may need a review from one of our doctors, including any discharge medication that might need to be organised. If you had a spinal or an epidural anaesthesia, the anaesthetist may need to review you. Electronic paperwork will need to be completed by your midwife. This can be a long process, so please be patient with our midwives, as a number of different healthcare professionals are involved in most of your discharges. Most discharges can be expected to be completed by mid to late afternoon. When you are home post-birth, there are a number of signs and symptoms that you may need to be aware of. Any of the following, please call our maternity helpline on 01279 827 286 and select maternity triage. You can attend our maternity triage up to 14 days after your baby's birth. Your baby or babies will need to be seen in paediatric A&E if you have any concerns. For any assistance following this time frame, please get advice from your GP or attend our emergency department. You will need to look out for a sudden heavy blood loss, which could be a secondary PPH, feeling unwell, dizziness, or your pulse racing. This could also be a sign of low iron. You will need to look out for signs of infection, which could be fever, shivering, abdominal pain, or offensive vaginal loss. Headaches, visual disturbances, nausea, and vomiting could be signs of preeclampsia. If you have any pain in your calf, redness, or swelling, this could be a sign of a blood clot in your leg. Any shortness of breath or chest pain could also be a sign of a clot in your lung. If you feel persistently down, anxious, or depressed and are finding it difficult to cope and enjoy your baby, you may be experiencing postnatal depression. If you had an epidural or spinal anaesthesia, please report any headaches, weaknesses in the legs, pins and needles, numbness in legs, inability to pass urine, or loss of bowel control. For any of the following concerns regarding your baby, please contact your community midwife or GP, or for any urgent or life-threatening matters, please attend our paediatric emergency department. Yellowing of the baby's whites of the eyes or skin could be jaundice. This can be normal, and your community midwife will assess and advise you of the next steps. However, if your baby is poorly and becomes unwell and is yellow, please do attend the hospital. An unwell baby may have poor tone, which is a bit floppy, poor feeding, not waking up for feeds and lethargic and sleepy, bowels not opening or not passing urine, breathing difficulties, or a high temperature. A high temperature in a baby is that of 37.5 degrees or over. If you don't have a thermometer, you can put a hand underneath baby's top and compare it to yours. They should be slightly warmer. Safe sleeping and room temperatures are all related in reducing SIDS, which is sudden infant death syndromes. The safest place for your baby to sleep is in their own clear, flat, separate sleep space, such as a cot or Moses basket. It's important to ensure your baby is lying flat on their back, feet touching the bottom of the cot, with a thin cotton cellular blanket tucked under their armpits and mattress. However, many parents may find themselves co-sleeping, and it's important that we teach you how to do that safely. Co-sleeping unsafely can increase the risk of SIDS. 1 in 203 incidences occurred by sleeping on the sofa with your baby, and 1 in 203 incidences occurred by a parent under the influence of alcohol and or drugs. 1 in 919 instances occurred by someone smoking within your home or around your baby, or co-sleeping after you'd been smoking. Exclusive breastfeeding reduces the risk of SIDS by 36%. We need to ensure that your bed can also be a safe place for your baby to sleep as well. Make sure that all adult pillows and duvets are kept away from your baby, and any items that may cover their head, causing them to overheat. For example, wearing a hat indoors. Do not bring any other children or pets into bed with you. Make sure your baby cannot be trapped or wedged or fall out of the bed, and don't put your baby in between you and whoever you sleep with. Never leave your baby unattended in an adult bed. If you or anyone else in the bed has recently drunk alcohol, smoked, or taken any drugs that might make you drowsy, co-sleeping shouldn't take place. Smoking is linked to 60% of sudden infant death cases. Co-sleeping can also be dangerous if your baby's born prematurely before 37 weeks or weighs under 2.5 kilograms at birth. Never fall asleep on the sofa or the armchair with your baby, as this can increase the risk of SIDS by 50 times. The temperature in the room should be between 16 and 20 degrees with light bedding or a lightweight, well-fitting baby sleeping bag. It is recommended that you avoid travelling for long distances in cars with preterm and young babies. Frequent breaks are advised for long journeys where you should take them out of the car seat for a period of time. Car seats should only be used for travelling and transport and not as a main sleeping place. Before leaving the hospital, we will need to see your baby in a secure car seat that's appropriate for your baby's weight and your car's make and model. Do not put your baby in the car seat in the front of your car if it has a passenger airbag. Your baby should never be left alone in the car. We're going to talk a little bit about some aftercare for you for when you get home. If you had any stitches down below on your perineum, keep your stitches clean and dry, cleaning with water once a day as a minimum. Change your pads regularly and wash your hands before and after changing them. You can take pain relief if you feel in pain. Paracetamol can be taken 4 to 6 hourly, 1 gram or 1,000 milligrams per dose, with a maximum of 4 doses in 24 hours. Ibuprofen can also be taken orally, 8 hourly and 400 milligrams per dose. If you had a caesarean birth, once your dressing has been removed, ensure that your underwear does not rub against your wound as this will cause discomfort. This dressing can be removed after 24 hours unless you have a special Pico dressing. Your individual care plan will be discussed with you by your midwife or obstetrician before you leave the hospital. Once dressings are removed, you should clean your wound once daily as a minimum with water. Ensure that you pat dry. It is important that you expose the wound to air to aid the healing process. Most surgeons will use dissolvable stitches, therefore nothing needs to be removed. However, some women may have a Prolene stitch that has beads, or you might have staples. These will need to be removed at home. Your midwife will advise you what stitches you have before you leave and the appropriate aftercare. When you leave the hospital, it's important that you rest and keep up to date with your regular pain relief. As before, you can use paracetamol 4 to 6 hourly, 1 gram per dose, with a maximum of 4 doses in 24 hours, or ibuprofen taken orally 8 hourly, 400 milligrams per dose. You are likely to be discharged with blood thinner injections if you've had a caesarean section. These contain pork derivatives, so please let your midwife know if you prefer an alternative. You will be advised on the dose and frequency according to your risk factors, and your midwife will show you how to administer before you go home. Please avoid heavy lifting and ensure that you're signed off by your GP before you start driving. You shouldn't drive before 6 weeks. You may experience some discomfort in your abdomen or shoulder. This can be trapped wind. To relieve this, you can gently massage your abdomen, keep mobilising and walking little and often, and try peppermint tea. A well-balanced diet and drinking plenty of water will help with wound healing and preventing infection and constipation. You can experience hemorrhoids. These are swollen veins in the rectum. They are common during pregnancy due to increased pressure in the circulatory system and are aggravated by constipation. They often appear following birth, so if you experience any discomfort, itching or bleeding, please inform your midwife. With bleeding, you should expect your vaginal bleeding after all types of birth. This loss can be quite heavy at first, but it will decrease in the first few days to weeks after birth. We advise you to use sanitary towels instead of tampons because tampons can cause infection. After pains can be common following the birth, and these might feel like contractions. It is important to ensure that your bladder is emptied regularly and you keep on top of your pain relief. You may also notice that during breastfeeding, your loss appears heavier and redder. Remember, if you have any questions, please contact your community midwife or you can call our maternity triage helpline.